So first of all, thank you guys. Definitely appreciate we actually look at this as an opportunity. And with all opportunities, it's not one single person that does this. These things happen with other teams. And one of the things I wanted to do is acknowledge some of the J&J volunteers in the back. So if you guys could stand up for me, I want to just acknowledge that for the good work I'm also excited that we've got Dr. Dayse Repsold with us today. When we go through these, I mean, it's all about information, education. Anita, I think, I don't know where you're at now, but I love the story, right, of the journey of kind of what it takes. These things are journeys, right? It starts with a little pain, there's a lot of process, there's a lot of knowledge and insights in terms of how we can try to get through this. What we want to do today is just basically share what the journey looks like, how we can help you with some of those things. Dr. Repsold, I don't know if we have slides, because I was going to try to touch base on a couple of those. But one of the things that we found over time is working with Janice. And Janice brings a lot of this to our attention. But unfortunately, there's a lot of disparities in terms of as African Americans and things of that nature. Thank you. How we take advantage of some of this information and insight. So again, I want to bring that up because today we want to share that information. We want to help everyone to be able to take advantage of these type of services that we get. If we could maybe come to the next slide for me, please. There's a lot of misinformation that's out there. I think Anita shared some really good insight today, right, of her journey. She's on point, right? Keeping moving, all of those kind of things, I think it makes a lot of sense. And following up. And in the journey, I mean, we also have not only yourself that's going through that, but if you think about your family and people around you, they're all involved with that process and they're impacted as well. So one of the things I would share is that we want to share this information with everyone, families and those who are going through this as well. And again, from a mistrust, lack of knowledge, we want to address those things today. Some of the folks who are in the back of the room today are going to help. We've got a lot of information we can share. I know Janet put a lot of the information in the packets and things on the table as well. So please take a look at that. One of the other things I did bring up here with, I think Anita mentioned Dr. Whitehead, but one of the things we've provided with us today is as an action that you can take. Who came to talk? Who were some of the surgeons or people in your area that you can begin to start building better insights and information around? So we have those kind of brochures that have references to some of the local surgeons, the community north, or maybe surgeons, those kinds of folks. So please come back and we'll share that information with you. So, I'll skip this and I'll just kind of go to, I want to just introduce Dr. Repsold. She was here last year. Many of you guys have had a chance to hear her. She was just very, very dynamic, very engaging. She is full of energy and has so much insight and information. We're always happy when we get some of our medical team that can come here and share insightful information. So we're happy that she's here with us. I'm going to kind of turn it over and allow her to kind of go with it. So thank you guys. We appreciate the opportunity.
Good morning, everyone.
Good morning.
So, first of all, it's a huge, tremendous honor to be here. And the reason is because my first commitment is a way before Johnson & Johnson and Repsold. My first commitment, when I decided that I want to go to med school, was with all of you. This is what it matters. My main objective is and was and has to keep being take care of patients. So one of the things that was here, why do disparities exist? If you look at the last bullet, it's saying cultural difference between doctors and patients. We don't have to have that. And between a relationship between doctors and patients always has to come first. Right?
Right.
So if you, in your life journey, when you have a meeting with a surgeon, with a clinician, with a health practitioner of any kind, if you don't feel like you are the star of this relationship, move on. Change the provider, because this is not good enough for you. So you have to be respected and embraced in any kind of healthcare relationship that you need. You are the main and the most important star in this relationship. Okay? There are some things that you have to go through. I will do, as any other technician, any other medical, any other surgeon, I will do the best that my knowledge allows me to. And these are the tools that I have to serve you guys better. But you also have to help yourselves. The way that you help yourselves is being aware of anything that happens in your body. Your body talks, and you have to be prepared to listen to it. The body gives all the hints. The body gives all the clues. Hear that. Listen to that. Because you are the main helper of your life journey. And when you understand what is going on, what is the problem, what are the issues, and how you can help, what are the resources that you can look for to help yourself, you will be a way more proactive, a way more helpful to yourself, and then you will be managing any kind of situation in a better and in a direction of a better outcome. So you have to work together, but you have an important part to do in this relationship. Okay, now this thing. So my name is Dayse Repsold. I put the in parentheses because nobody knows how to say my name. As you notice, I'm not American. I'm from Brazil. And so you also notice that I will have a lot of English mistakes. I'm sorry. I wish I could make it better, but I will hope that at the end of the day you will get my main message. So, but if you don't, interrupt me and say, not good. You don't say this word right, so I will be learning. I am the Senior Medical Director for the Osteosynthesis, the company of Johnson & Johnson, and I am with them for about 17 years. And I am orthopedic and trauma surgeon. But you see this letter after my name doesn't mean anything. Still, whatever how many letters I have after my name, you are still the most important person. Those letters just graduate me to serve you better. So don't be ashamed or impacted by the letters after my name. Not mine and nobody else. Okay? Let's talk about the disease that is probably, I would say 90% of all orthopedics disease has something in common, is osteoarthritis. So except for cancers and trauma, the disease for orthopedics probably have in common osteoarthritis. You're going to be talking about that. And you're going to be focused on two articulations, two joints, hip and knees, okay? This is the hip joint. So we call hip joint ball and socket joint. And the reason is because, you might to hold this microphone, please? The reason is the hip has a cup, and the femur, at the end of the femur, has the head of the femur that go connect with the hip. So it's a ball and a socket. So this is why we call it ball and socket joint. And it's very stable articulation. So this is the femur, this is the end of the femur, and has this spheric form, so you call this the ball. And this is the hip. And inside the hip, that is this cup that I mentioned to you guys, where the femur head will connect with. So this is pretty much the hip joint. And this is the knee joint. Okay, on the knee joint anatomy, you have the composition of 3 bones: the femur, the patella, and the tibia. This is the knee joint. Holding these bone structures, you have 4 main ligaments. The cruciate ligaments, anterior and posterior, and the collateral ligaments, lateral and medial. So this is a stable joint, a normal joint. This is the anatomy of the knee joint. Osteoarthritis. You know, in medicine, a lot of terminology comes from Latin. So to understand what it is, you have to get some clues on Latin. So, osteo means bone, arthro means joint, and itis means inflammation. Inflammation on the bone or any other inflammation in the body. When you see the suffix itis means inflammation, wherever it is. Here is a bone and joint. So osteoarthritis means bone and joints inflammation. So here you can see a healthy knee, and this is the femur, this is the tibia, this is the patella, and this is the articulation. And we have a space between these 2 bones. And here we have a graphic of a diseased knee joint. And we have all this erosion going on the cartilage, and also the bone get affected. And here on the hip, so on the right you have the knee, the normal hip joint. On the left you have the hip joint affected by osteoarthritis. So you see the destruction. So it comes from here to here. And this is what the inflammation on the joints can become and can make your joint suffer. So what is osteoarthritis? Osteoarthritis is a progressive, irreversible loss of articular cartilage that leads to pain, stiffness, loss of mobility, and sometimes deformity. Some of us here, me included, we have white hair. And when the white hair bother us, we dye it, right?
Right.
I have been doing this for a long time. So, it's a part of life. It's a part of journey, right? You get white hair. Okay, we can deal with that. But that doesn't mean that you have to suffer with that. So in the first day that the white hair bothers me, I am able to do something, right? Same thing with joints. Is part of the life? Yes. Wear out. We think, wear and tear. You have to be suffering for that? Of course not. So the same way that you can dye your hair, you can treat your osteoarthritis. You don't have to be bothered by that, right? It's a little bit more complicated, a little bit more expensive, but you can do it. So the most common form of arthritis is the osteoarthritis. There is some other forms. The most common, osteoarthritis. And is associated with age, like the white hair. Is also associated with overweight. And this is why we say that it's a wear and tear disease. It is also can be associated with trauma. So when you have a trauma that change the balance or the well-being of your articulation, this can be precipitating somehow the osteoarthritis. So in this case, you don't have to wait for 60, 70 years to notice an osteoarthritis. You can have it very early in the life journey. What do you go with osteoarthritic joint? So all this are the symptoms: painful, stiff, swollen, deformed, noisy, unsteady. All those are symptoms. But if you think that the first one is pain, we have to think about that. Because pain is a symptom. Pain is just your body talking to you that something is not right. And even when we're willing to have this pain away, pain again is a good caller that something is not right. So the big mistake is I get rid of the pain and then I don't treat the disease anymore. This is a big mistake, because when you get rid of the pain, you're not necessarily addressing the disease that is going on. The disease is still there. You're just treating the symptom. So imagine an iceberg. When you look at the top of the iceberg, this is just the tip. There is a huge structure beneath the level that you can see. Same thing here. So treat the pain, of course. Nobody has to live in pain. But don't forget that the pain is just a communication between your body and you. Pay attention. Something is going on. And then, if you treat the pain and don't address the disease, all the other bullets will show up somehow. And I spoke with someone today. When you go to your doctor, and I promise you, the most important tool that I have, being a surgeon, my hands. Let me touch you. Let me examine your body. Because probably most of the information that I will receive from your body, I will receive through my hands. So I have to do, so when you go to a doctor that don't touch you, that don't do a good physical exam, remind them, say, well, you know, I was in a meeting and the surgeon said that all the doctors should examine and put their hands on me. Please feel free to, because it's a very important step. And if I replace the power that a good physical exam give me, and I replace that by images only, something is not right. The imaging, and you have to have good x-rays, but we call this complementary exams, because the physical exam has to give me most of the clues that I need to have a diagnosis mindset. So what will build the mindset, what will give me all the clues that I need, when I order one x-ray, I have to be already aware of what I'm looking for. If I don't know, and I just order an x-ray, when I find it, I won't recognize. Okay? So, be mindful that you deserve to be well examined. So, when I do this good physical exam, I will do first a good visual inspect. I will see if there is some imbalance, if there is some scars, if there is some, so you know, all the hints that I can have. There is a limp, there is a crack, there is any effusion in the joint that I am examining. How the ROM. ROM stands for range of motion. So how much the patient that I am examining can extend the knee, can flex the knee, extend the knee. I have to hold myself. I will help you, help me again. I will share you will share the things. So flex the knee, extend the knee, flex, extension, flexion, extension. So how much is your range of motion? And for the hip, the same thing. How much you can open your hip, close your hip, rotate your hip. So all this I have to ask you to do when I am doing an appraisal, when I'm doing the physical exam, because this will give me some hints, okay? So this is what we call ROM, range of motion. Do you have any instability? When you walk, you limp, you feel like instead. So I have to be aware of your BMI, body mass index. Are you overweight? Because when you get older, and I know this is so sad, when you get older, we win some pounds, right? And I was talking with someone today. When I was young, I always complained that I was super thin. And I said, I want to be big. I want to have tights. I regret so much. Because, it's so much harder to lose pounds when you get older, right? Yeah. Tell me that I'm not alone in this story. So, right? Okay, thank you very much. But so, I have to be aware if there is any overweight, because, think, my knees, my hips are holding and sustaining my body weight. Right. If it's 60 kilos, okay, this is how the weight that they have to handle. But if it's 120 kilos, I am imposing double weight in the same joints. So that you will pay this price. So it's important to figure out the body mass index. When you were in the doctor and they ask you, in a scale of 1 to 10, how much is your pain? This is why. We have to know 1 to 3 is low, 4 to 7 is medium, 8 to 10 is high. So it's important to figure out how much is your pain, how much suffering you get from this pain. And here are the x-rays. They are valuable, absolutely valuable. They will give me things that my bare eyes won't be able to figure out. But again, it's a complementary exam, okay? So when you look at those are the knees. So when you look at there is a space between, this is the femur, this is the tibia, and you see there is a space between these two bones. So when this space gets smaller, it's because something is going on this joint. So one of the aspects that is measurable and seeable in the x-rays are this distance between the bones that we are examining. This also applies to hip. So if you look at this one and you see the space, and when you look at this one and you see that the space is a way smaller and there is a wider image here, this is one of the signs of osteoarthritis. And this diminished in space is painful by itself. And when you look at the hip on the right, you see that this is I won't say normal, but this is a better shape hip, because you still see there is a space, but the space is already smaller than should be, and there is also this white line here that normally you shouldn't have. This is another sign of osteoarthritis. So this is the beginning of the disease, but this is how the disease can end. So here you don't see space, you barely can differentiate the two bones, the hip bone and the femoral bone, so it's all a big mass of bone. So this is how you will see a severe case of osteoarthritis. So between this and this, I promise there is a lot of things that we can do to avoid getting this condition. To control the pain, you can have a bunch of anti-inflammatory drugs and will alleviate the pain. You can get glucosamine sulfate, you can have hyaluronic acid injection, you can have local balms, creams, hot and cold packs, sleeve embrace, cane walkers, physical therapy, acupuncture. There is a bunch of non-surgical measurements that you can take to alleviate the condition that you're going through. And these are the non-surgical treatment options. So pain controlling again, activity modification, weight reduction, physical therapy. Let's talk a little bit about each one of these. Pain controlling, we already talked. We don't have to live under pain. But resolving the pain doesn't mean that you are resolving the disease. You're just treating the symptom. Active modification. It's so easy to get lazy. It's so easy to say, you know what, I'm not walking today. It's cold outside, I have something to do inside. So you always have a huge list of excuses to don't be active, right? Big mistake. Big mistake. Because every time that you stop moving your body, understand that this is the thing that they have to do. So let's be immobilized. And when your joints and your muscles understand that, they get even more lazy. So, and this is the first step to be overweight. So one thing get to the other. And then, if you don't change, if you don't become a little bit more active, and not saying that, who was the person that loved you, my hero for today? You don't have to run a marathon like she did, but you have to wake up with the mood to keep moving throughout the day. You can start with small steps. You can go from one room to another and do this back and forth. But you have to instruct your body that they have to be active. You know what? We'll have the eternity to be inactive. So let's enjoy while you can, right? And then there are some surgical treatment options. And again, there is a huge, a good amount of things that you can do, even in surgical terms. You then have to start with hip replacement, knee replacement. There are some other steps that you can go through addressing the disease, but that will somehow postpone the need of a joint replacement. So this is why it's so important to hear your body message. Because osteoarthritis didn't start with the severe and damaged situation. It started initially with a little thing, another little thing, and another little thing. You start pain, a little bit pain, and you didn't pay attention. Or you just took the medication and said, now I'm feeling okay, now I'm good. And you keep not doing the things that will address the disease. So, to every single sign of something not right in your body, pay attention to it. There's a huge message behind it. So, the steps that you have. So, you can, sometimes when you have osteoarthritis, one of the initial signs is all the joints, not all, but most of the joints, at least hip and knees, they are infused with liquid. In the situation of itis, one inflammatory disease, this liquid, to protect the body, becomes bigger in amount. And this will somehow distend the joint. But the joint is a closed space. So there is an amount of distension that is possible. After all, the distension gets reached to the maximum level, will start to pain. Okay? So then you can, if you see that you have a lot of swallowing in your joint, that probably because there is a high level of liquid inside. So this is why aspiration is one the same way. So hospitalized more than 2 weeks. 18% of white population be concerned about that, and 45% of African American population is concerned about that. Understand joint replacement. So the information is much more accessible to the white population. Why? How come? Why the level of, why the tone of my skin change that? How come? It's not related to the color of my skin. This is an information for human beings. So, thank God that I'm not an African American, because I will be a revolutionary person. I will be in jail in 5 minutes, because I get so frustrated with that. So, African American population hear more about joint replacement than white population. So again, it's a matter of access. You have to have the same access that I do. Simple like that. We're both human beings. Doesn't matter the color of the skin. What we have inside, the same joint that I have, you have. The same blood that I have, you have. Why would it be different? Because the color of my hair or my eyes? Really? Remember that I mentioned to you that to do osteotomy, we have to have only one side of the joint of the knee being affected. And this is what we call unicompartmental knee disease. So again, if I trace a line that divides the knee in two halves, I will have two compartmentals. One is the medial one is the lateral one. So most effective one is the medial one in everybody. So the medial size of your knee is normally most affected than the lateral one. The space between the two bones can collapse, and this changes the alignment of your leg. So this is a good example. So this is the normal alignment. And when you have the disease eating the medial part of your, the medial compartment, you have this kind of leg disease, bone legness. And this overweight on the medial side is a good contributor for pain. And this is a good image, X-ray image of a unicompartmental disease. So when you look at that and you see the streamlined space here compared to the other side, so the medial compartment is so much has so much less space than the lateral one. So this is an indicative of this compartment is being affected by osteoarthritis. And this is further steps down the road when you have a more severe destruction. And this is how, if you compare the lateral compartment with the medial one, this is how, is a schematic picture, but this is how your cartilage will be seen compared with the normal one. And I think that we have, and when you're going to check the booth outside, back there, I can share with you, because we have some displays that show the progression of osteoarthritis. When you have unicompartmental disease, only one side of your knee being affected, there is some options. The Osteosynthesis has some options for unicompartmental joint replacement. So you don't have to replace everything, because this side is pretty normal. The only affected one is this one, so you can treat only this one. This is what we call polycompartmental knee replacement. And this is when you have the entire joint, the whole joint being affected. So the lateral and the medial compartment. So you see there is a big destruction here. When you look at the lateral view in the X-ray, you see the amount of bone production. You barely can see the space between femur and tibia. And this is the patella. And so it's a massive destruction, and this is the multi-compartmental disease. And for that situation, you have the total knee replacement. So this is one of the options that the Osteosynthesis has. So this is the total knee compartment disease. So you change the entire articulation in femur, the entire articulation in tibia, and then you have what we call total knee replacement. So, and this is the same concept for knee and for hip. So everything that I said about knee is applicable to hip as well. So what is the hip replacement? It's the same thing. It's a surgical procedure that removes the diseased articulation, the diseased joint surface, and replace it with implants. So here is a picture of a very severe hip disease. So when you get to this stage, there is nothing else to do. So even if I do a cut here and change the undulation, the destruction in the surface is so major that there is nothing else to do. So you have to replace. So you go from this to this. And one of the things, the technicalities that you have to achieve, one of the main failures of joint replacement is when you look at here, you see there is a metal here, and this metal is interacting with the bone. This is in the femur. So this interaction has to be and be maintained very steady, very fixed. So everything that change the movement point from this relationship to here is beneficial. And then now what we do in the Osteosynthesis, the type of prosthesis that we have allows, because all this relationship between the prosthesis and the bone in the femur happens also in the hip. So there is a metal here going inside the bone. And this relationship between metal and the, don't get scared, you won't see that. You only get the benefits. I will see that, I promise. So all this relationship between the metal and the bone has to be very, very steady, very, very stable. So where the movement will happen? So the movement will happen in what we call bearing. So that is between the head, the new head of the femur, and the hip, that is what we call liner. And this is where the movement happens. So the part that is attached to the bone, not supposed to be moving, and won't be moving, because the movement, when you move your hip, the movement will be between this part and the liner here. This is what we call bearing. So this is what I just explained. What is bearing is where the movement happens between the head, or now the ball, and the hip. So it happens between the ball and the liner. I think that you have some examples in the booth back there. So those are some of examples that you have. And then you have some technicalities. So there is different types of material that you can make and construct the joint replacement. So it can be done with metal, different types of metal, can be done with plastic, different types of plastic. Normally we call, the most common plastic that you use is polyethylene. And then there is different types of other materials. And now, one of the most popular one is ceramic. Ceramic is a very what is the word for that? Resistant, and it's very light. So this is why it's one of the options after years and years of study throughout the industry. The engineers come up with ceramic as a good option for joint replacement. So you can have, you can mix this different materials together. So you can have a prosthesis that is ceramic on ceramic. So the ball is ceramic, the cup, the liner is ceramic. You can have the liner in polyethylene and the head in metal, or you can have ceramic on polyethylene. So there is a difference, and each one of these distinctions will be case by case evaluated, depending on your needs, depending on your size, depending on what is your condition. One or other will be more applicable, more well applicable. So the good advantage of diffuse synthesis with what we have is a huge amount of options to fulfill different needs. In a recent study, this is from last year, so 600 people who choose hip replacement, more than 96% said that hip replacement enabled them to move freely or without pain. 90% say that they are able to participate in favorite activities. Another study said that more than 95% of patients who receive Coral and Pinnacle, two systems of diffuse synthesis, did not have any concerns even after 10 years of the surgery. This is a mutable, not changeable truth? No. We may have some cases here and there that doesn't have the same records. It happens. It's not mathematics. It's live organ, so can be different for a variety of reasons. So, but 90%, 96% have a very good outcomes. So, here's a quick quiz. How many people in the United States undergo knee replacement surgery each year? So what do you think? 150,000, 790,000, or 400,000? What is your guess?
400.
400,000? Yeah? 790,000 patients has. Because this is the second question. You see the second question? What is the disease leading cause of disability in U.S.? Heart disease, diabetes, or arthritis? Arthritis. This is why. So you are a leading cause of disability, even more than diabetes and heart disease. So there is a lot of people. Because, and the reason is simple. Again, we have at least two joints holding our weight throughout the life. It's a lot of things to hold because it's every single day. It's worse than marriage, right? Even worse. And how many people get married for 10 years? They give up on way before, right? So, many times I look at my husband after 32 years of marriage and, you know what, you look like osteoarthritis here. So it's impressive, these numbers, right? So it's a lot of numbers. And there are some myths that you have to, let's go through all these 5 myths that we have. So number 1, arthritis pain is just part of aging. It's just something that you learn to live with. Right? Remember the white hair? Same thing. It's part of aging. Yes, it is. You have to deal with that? No. So 2, total joint replacement won't feel natural. If for the 96% of people that has a good outcome, that has a good result, they don't even think that they have some prosthesis on their body. Unless you have some problems, you won't feel that you have something in your body. I am too young for joint replacement surgery. This was false. This was true some years ago when the joint replacement was designed and manufactured for elderly. Not anymore. And you know why? Because people are getting more active. So even a young person, even a young population that started doing more sports with more impact. You know, if you look at the knee of a soccer player or a tennis player, if you imagine that all the movements that a tennis player does is like that, and they put a lot of stress on the knee, so the wear and tear of this knee, even being an athlete, is way more than ours. So, and because of that, because there is a younger population with more stress on the joints, we have to think about, okay, how are you gonna address that? Is a new need. So companies like the Keynote has to be thinking about, okay, now you have a younger population that is with the same need that the elderly, because they are overusing the joints, right? So there is no I'm too young for joint replacement. I should wait as long as possible to get a total joint replacement. The problem with that is, this is also true related to the previous one. When we have joint replacement designed and manufactured to elderly population. Not anymore, not today. And the problem with that, if you wait too much, you saw that the destruction will be more severe. So we'll need more resources to recover. So this is another myth. All joint replacements are the same. Again, no. It's not the same within my industry. So in the Q-Synthesis, when I look at the portfolio, I have more than one option. So if it's not the same in my industry, it won't be the same in the competitors. It won't be the same in the industry at all. So, I have something in mind when I design this family of prostheses, this family of prostheses, and this family of prostheses. We just tackling what is the condition that is more specific to. So there is no one fits all. And here we're going to be talking about each one of them again. Reality is that conservative treatments can lessen pain but may prolong limited function. And this is the issue that we mentioned already, that you discussed. Be careful when you get rid of the pain if you're just taking medication, because the medication won't change the status of your joint. Okay? So be careful. And don't think that just because you're not feeling pain anymore, everything is solved, everything is addressed. It's not. The second myth is total joint replacement won't feel natural. We talked about that already. So there's been many advancements in implant material for joint replacement. Diffuse synthesis joint reconstructions offer more implants options than ever before, include a wide range of size, design, and materials. Is what I told you before. There is different types of material, different types of model, size, and options, depending on what is the specificity that you need. I'm too young for joint replacement surgery. Again, not true. Total joint replacement are not based on age anymore, but on the personal level of pain and immobility. Myth 4, I should wait as long as possible to get a total joint replacement. Another mistake, another myth. We should get the replacement as much as you need it. So let's get a good impression of your knee, a good physical exam, good x-rays, and see what it stands for you. What is the most available and most well-fit options that you have. All joint replacement are the same. Again, no. One size don't fits all. Joint replacements vary by shapes and design to accommodate specific patient needs and lifestyles. And here the benefit of walk. Walking is a wonderful, wonderful resource. I'm not talking about running, I'm talking about walking. And when you walk, you send message to your homeostasis, to your body, that we have to keep active. Again, remember, you will have the eternity to be lazy. So use what you have in your advantage. While you are alive, be alive. So, let's be active. We should start moving today and running and walking. No, this is not what I'm saying here. What I'm saying, that is obvious advantage of being active. But this advantage has to be fit in your body conditions. So before moving out, talk with your primary care physician, talk with your orthopedic surgeon, see what is the status of your baseline to see how much you can start doing. You maybe start with just 10 steps a day. Next week, you're going to go to 20 steps a day. It has to accommodate your need, your body conditions, okay? There is some general advantage. You strengthen the muscles, you lubricate, you have more lubrication on your joints, you improve flexibility and range of motion, you decrease the odds of new knee pain, and you reduce the risk of osteoporosis by building bone mass. So there is a lot of benefits in being active. Look for them. This is the benefits for the joint health, but is there also benefits for the overall health? Your weight management, your improved mood. Don't talk to me when I come back from the running. So, respect the mood fluctuation. But after 10 minutes, okay, you can talk. Okay? So, but that is definitely an improvement in the mood. When you feel more active, when you feel more prone to the life, you have a better mood, no doubt about it. It has cognitive function. This is very much true. Boosts circulation, and you have a better sleep. Of course, you're going to be so tired that you're going to lay down and sleep. No other option. But anything that you do, don't start before you talk with your primary care physician. Okay? But if they give you green light, go for it. Start moving yourself. Start to dance, start to walk, start to do something that make you bring a smile to your face. I think that's it, people. So thank you so very